Hello and welcome to our COVID-19 update program at this hour. I am Ladi Akiridoluale. Here are our highlights. Federal government okays the evacuation of Almajiris as it says collaborations are on to make use of dilapidating Almajiri schools across the northern states. Federal government insists Madagascar COVID-19 remedy was offered in good faith to all African countries. And worldwide death toll surpasses 300,000 for COVID-19 virus. News from across the world has been featuring the postponement and cancellation of events, conferences, conventions, sports leagues, and a lot of other things due to the COVID-19 pandemic, which is immediately driving down travel and tourism for business and pleasure. As the phrase social distancing, or if you like, physical distancing becomes a household term, many people are playing it safe and staying at home, while some are attempting to continue typical day-to-day operations through restrictions. Curfews and in some cities still full lockdowns have created a precarious business climate for restaurants, bars, cafes, and other businesses dependent on guests. These roadblocks are significantly impacting their bottom line. The road to recovery is likely to be a long one, and these businesses have been asked to start immediately to prepare. The needed strategies and means of survival is our focus today on the program. But first, some other stories. The Minister of State for Education, Emeka Wajuba, says he's aligning with the northern governors on the return of Almajiri to their various states of origin. Mr. Wajuba explains that the ministry is collaborating with state governments and individuals to take up some of the 157 Almajiri model schools built by the past administration across the northern region. He was speaking at the daily presidential task force briefing on COVID-19 in Abuja today.
Over 157 such schools were built a few years back. Within the first part of this administration, the Honorable Minister of Education, Malam Adamu Adamu, began the process of getting different state governments and Islamic scholars to take over these schools. I happen to be privileged to have come in quick in August when I handed over the first few ones in Bauchi. We handed over to Sheikh Dawir Bauchi to begin this process. The argument is not whether what they are doing is right. The argument is whether the time is auspicious. And if you look at the argument the governors have made, they said this is about the best period to capture everybody where they are because they are not moving. And that argument is extremely plausible. We only reacted in line with the regulations that had been imposed about curfew in between states and whether this was an essential service at this time. However, we are working with all state governors and all sects in the north who may want to use these facilities. They are all available, and we are continuously engaging with them to either improve them or use them in the best way possible. So they are not a waste. And the money that had been spent, maybe you may have issues with how it was spent, but those facilities are there, and we are now putting them into use. We hope that with what has now happened with taking off some of our children off the streets and then finding a way to progress them into and mainstream them into formal system, we can then use most of those facilities.
Meanwhile, the chairman of the Presidential Task Force on COVID-19 and Secretary to the Government of the Federation, Mr. Boss Mustafa, has been reacting to the criticisms of offers for a solution to the COVID-19 virus by Madagascar, saying it was not based on a request by Nigeria. Mr. Mustafa added that Nigerians and researchers, in particular, are encouraged to follow necessary protocol in the process of validation, as the presidential response team will not take up the responsibility of certifying agencies.
Nigeria did not ask Madagascar for any solution. That has to be very, very clear, because I've seen some narrative out there giving credence to a line of story that, for me, I think is only destructive. Nigeria did not ask. The Madagascar government decided to airlift quantities meant for the African countries. That of West Africa was taken to Guinea-Bissau. So all the West African countries, all the members of ECOWAS, have their commodities offloaded in Guinea-Bissau. And that was the one I referred to, that we were making arrangements to evacuate. But the impression out there is as if we abandoned homegrown solution and we were looking for Madagascar solution. We didn't ask for it. But that does not in any way downplay what we have asked our researchers and our scientists to do. In the last one or more week, I have consistently made this appeal. And for those that have been in the field of development in medicine and different inventions, they know the protocol. The protocol is to submit this thing to the appropriate organization that has the responsibility, that is known, established by government through an act of parliament, for it to go through the processes of validation. It is not the responsibility of the task force to validate these things. So my appeal to our scientists and our researchers, don't bother sending them to the task force. Send them to the institutions that have been set up by government to do their job.
Boss Mustafa, chairman of the Presidential Task Force on COVID-19. Several days into easing the lockdown to tackle the COVID-19 virus, restaurants, eateries, and sit-out places, as well as hotels, are yet to make any significant sales since resuming, albeit on a skeletal level. Many of the owners complained of low patronage, which is forcing them to review the employment status of some of their staff. This, of course, is against the background of the COVID-19 pandemic. Our correspondent, Olu Phillips, visited some of these outlets and brings us some details.
Lagos, the bustling city and commercial center for Nigeria, rising again from the roots of a sit-at-home order. It's already a semblance of what it used to be, but don't confuse these movements for a robust economic activity. People are just keeping faith, especially for those businesses who have been cleared to operate, like the food and catering services. In the name of social and physical distancing, everything has changed. Overgrown grasses, weeds, and unkept flowers at this breakfast place in Yaba tell the story. From a season when tens of people scrambled to get their orders out to a virtually unkept garden of no one, COVID-19 can be more real for food and hospitality business people.
There should be some palliative for business owners, especially for small businesses like this. Like, I've had to lay off some staff. I just have about 2 people coming in as against 13 people who are working for me here, and it's not easy on them. And, I can't keep up. I couldn't pay salaries. The first few weeks, I could do a little bit, just hold on to this. But eventually, I just couldn't cope.
There are a couple of restaurants and eat-out places on the Lekki Admiralty Way in highbrow Lekki Peninsula. This period is simply not their day. For instance, this food place now operates a drive-through policy, one which is aimed at reducing contacts. Victoria Island, Legali Ayarinde, is a busy business district area and a thriving center for food and drinks, a good enabler for those who want to wait out the daily rush hour traffic at the close of work. One of such venues is now a ghost place. This open space, up till early last year, was a besieged space for evening grills and cold drinks. It's a different tale now.
We still haven't downsized. We still have kept our numbers. We were still able to, I won't call it pay salaries because they didn't work for it, but everybody got paid in April. What's going to happen in May? How long can we continue to do this?
From 60 chickens grilled weekly to just 2, and with less and less orders from customers, it couldn't have been worse than this. For small eateries, big franchises, COVID-19 has become a leveler for these business owners. Much remain the same in terms of food services. Part of the new normal and strategy to survive is the reactivation of dispatch services. Deserted barber's shop, empty hair studio, and no outpatient at this dental clinic.
They don't care now. What's their business?
The nights belong to some people, but like candle in the wind, it has blown away. The once busy streets of Surulere at night is a mere shadow right now.
Those in the food, they are doing well. But right now, right now I am into wholesale and retail. I supply clubs and bars. And right now, most of them are not open, and it's when they make sales, I make sales. I do retail, but I actually make bulk of money from the wholesale. A lot of these hospitality businesses, their premises are on lease, their rents are running. So, the government really needs to tell us what's going on. What do we do? As per we that are into this drinks business, the hotel, club, bars, lounge, what do they do right now? Is the government going to provide grants for us?
If you knew the National Stadium nightlife before COVID-19 and tried to relate that to what it has become since it was locked up by the federal government, its scholars will be heartbroken that the gates are still shut. Beneath Igomu Bridge around the National Theatre shares the same fate as the National Stadium. Businesses have resumed since the ease of lockdown. What may not have resumed in earnest is a corresponding patronage which poses a big threat to their bottom line. If tax returns data is anything to go by, perhaps the Lagos State government could do well to assist these businesses using such data. Olu Phillips, Channels Television News.
Olu Phillips is in Adetokunbo Ademola on Victoria Island in Lagos, from where he joins us at this time. Olu, from what you saw at the various points that you visited and which were highlighted in that report, have the owners or the operators begun to put in place measures that may make it possible for them to operate in the time of COVID-19?
Laddie, good to have you. Yes, I'm on a lonely street, not because it ought to be like this, but of course you know what we are going through at this point in time. But when it, as regards your question, there are two sides to a coin, and if these business owners are complaining of not having patronage, what they also need to understand is that there's a trust issue that has a perspective in the area of health. People are concerned about health. They don't trust enough to come to these people and sit down and have food. So what these business people also need to be doing, which is the other side of the coin, is to begin to retrofit their premises to be post-COVID-19 compliant in such a way that people can have the confidence to come in and dine. I see a lot of that happening right now in the Netherlands. Restaurants, for instance, in the Netherlands are beginning to retrofit and make their eating places very comfortable in terms of health-wise. Airlines are beginning to do that. If these guys are going to be in business, then they have to begin to retrofit in such a way that it can help surge up the confidence and the trust of those who want to part away with their money.
Olu, we will, of course, be checking in on you as you move around, try to update other sectors of the economy and how they are to survive under the COVID-19 era. Now, from the nation's commercial capital in Lagos, we go to Abuja, where we also examine the impact of the COVID-19 pandemic on the hospitality industry. Restaurant owners in Abuja are asking for a further easing of the lockdown so they can stay in business while adhering to personal responsibility rules. For many of these people, if the situation is not assessed, they might shut down in the next few months. Our correspondent, Kayla Megwa, reports.
Restaurants across the globe are facing the same crisis. A dramatic decline in sales leading to an inability to support day-to-day operations and staff salaries. With the easing of the lockdown, restaurants have new rules on how to operate.
They are allowed to open from 6 a.m. Until 8 p.m. when the curfew commences, but the operational guidelines, how they operate inside, is the fact that they can actually sell food to persons, but they are not allowed to operate eat-in operation.
When you come in from the gate, the security man gives you hand sanitizer, and you must be on your nose masks. You cannot sit and eat here. It's only mainly takeaways.
The S&P 500 Restaurant Index declined by over 10% this May. Restaurateurs in Abuja say they can barely keep their doors open.
Before the lockdown, we had like 12 permanent staff and like 2 other ones that were like part-time. But now we had to downsize.
If we continue 4 months, we broke up, we close down. Yes, especially because every month we are paying diesel for generator.
The ban on interstate travel challenges their supply chain.
There are some that come all the way from outside Abuja that actually come only on flights, like our seafood. That has stopped. Like, if I finish this batch now, I'm done.
For some restaurant owners, it is possible to be open for business and keep everyone COVID-19 free.
For example, tables, I can divide it. Each table, I can leave like 2 meters in each one. And I cannot leave more than 2 people to be sitting on tables. So I also, with the sanitizers, if they open business park for restaurants now, within COVID-19, I can bring a room, spare the room for complete sanitizer. Any customer came in or stepped in from his head to his leg.
The idea of a world moving forward with COVID-19 is one many have not been able to wrap their heads around. But the argument is out there that a lockdown is not the answer. The proposal is a world where restaurants and other businesses can run, but with strict safety measures in place.
Coming up after the break, we'll talk to one of those affected by this. And of course, we'll get Kayla's take on her reporting, as well as talk to a public health physician on all of this and what the implications may be for our health. Please stay on with us. Thanks for staying tuned. Welcome back to our COVID-19 update at this hour. Let's go to Abuja, where our correspondent Kayla Megwa joins us from our studios there. Good evening, Kayla. Now, your report this evening seemed to emphasize the fact that those in Abuja who are affected by this seem to be preparing better than those elsewhere. Would that be a fair comment? And if so, how are they doing this in your view?
Good evening, Ladi. I actually think so. I actually agree with you on that because talking to them, you can see that they're not talking about, oh, you know, the lockdown, how it's affecting us, Yes, there is that part of the conversations I'm hearing. But what I'm also hearing is plans not post-COVID, during COVID. So we've heard from the World Health Organization say, this disease is not going to go away. And if you really think about it, Ladi, no matter how many lockdowns we have, everything that we do to contain the virus, it's never going to be completely gone. So we have to be able to adjust to a new way of living. And that applies to everybody and every business, including restaurants. One of the restaurant owners today was telling me how, you know, he's thinking, let me have a room where people can come in and I sanitize them head to toe before they come sit down. I can't sit more than 2 people on the table. How do we adjust to the new norm? People don't like hearing the word norm because they say this lifestyle is not normal. However, there is a new way of living. How do we adjust to that new way of living and still grow our businesses? And that's what I'm hearing from a lot of the restaurant owners, which is refreshing because that means that people are thinking forward. If we constantly continue thinking about how it's affecting us, now I'm not saying don't think about that, but you have to start planning ahead because this is something that has come to stay for a while, Laddie.
All right, Kayla, thank you so much for that. Our correspondent, Kayla McGuire, reporting on the situation in Abuja. Do stay safe out there, Kayla. Now, in the studios with me, I'm joined by the Chairman, Board of Trustees of the Federation of Tourism Association of Nigeria. He's also President of the Hotel Owners and Managers Association in Lagos. Mr. Sam Alabi, thank you for your time.
Thank you very much. Good.
You watched the two reports, Lagos and Abuja,
Yes.
and what is happening.
Yes.
Maybe how I should begin is by asking, have your members been part of the funding that the CBN is supposed to have provided in terms of some kind of relief for businesses affected by COVID-19?
I can say authoritatively that as of today, there's no relief in terms of finance advance to tourism industry as of now. I'm aware that maybe the health sector might have benefited, but as we speak, the tourism industry is here to benefit from any relief of whatever sort, provided either by Central Bank or other government agency. None.
How are your members preparing for the era of COVID? Because the two reporters, both Olu in Lagos and Kayla in Abuja, amongst a lot of other people who have looked at this, say that it cannot be business as usual for your members and other associated industries.
Yes.
Now, with COVID and physical distancing and every other thing that has been introduced. Are your members thinking of what they will now do? What are they now doing?
Yeah. Let me say from the beginning that the government appears to be more hotelier than the hoteliers. They did not consult properly hotel owners, restaurateurs, and others before coming out with their policy of total closure of hotels and prohibition of in-service for restaurants. Had proper consultation be done, the parties will have come up with a solution that will not only satisfy our business interest, but the public health interest. Today, I look at the report talking about minimal business in hospitality. It's nil. The business is nil because the government of Lagos and Abuja, I'm aware, closed down operation of hotels. They have even forgotten that major hotels with, permit me to use this word, stranded guests that were in Nigeria, had no houses, had no alternative accommodation, had been in hotel for years, were in the hotel before government says no more hotel business because of COVID. Those people are there. The problem is there. And talking about restaurant business, if banks are allowed to operate, even with the clumsiness of customers in the bank, I see no reason why restaurants should not be allowed to provide safe distance, 2 meters apart to tables, and they continue to run. But unfortunately, what we have been allowed to do is take away business. You order and you take away from the restaurant.
But that is in the first phase of the easing. One would assume that as the easing goes on, they may be allowed to do more.
We have not been vertically told that way, and it will be dangerous. I've seen a video clips on social media where some people who attended the nightclub were asked to lie down, and they were being flogged. So except government come out clearly, the restaurant owners, food owners can operate. It will be dangerous. The only thing that our members can safely do now is to do home deliveries. You order and you deliver. But for a restaurant now to start to do business like as it were, that may be a dangerous thing to do because the Lagos State government guideline on safety of occupation and health did not address specifically that area of whether food could be served in the restaurant. What is provided is And when customers are filing in, they are to maintain one line, they are to give 2 meters distance, they are to ensure that those going out will not pass through the same entry point so that there is no merger of customers. These are the general things they've given. But I can say...
What would you ask them to do now? Because it's still not too late. You said, okay, in the run-up to the closures, which followed the discovery of COVID-19 in Nigeria, the stakeholders were not consulted.
Yes, yes.
Now, in order to ensure that these businesses continue to run, what are they to do? What if you were in a position to tell them what are they supposed to do now?
The first thing to do is to allow hoteliers, hotel owners, to come up with proposals. How they intend to run their business now. After all, we're also human beings. We're also afraid of contacting COVID. Let the business owners come up with their proposals. Tell the government, this is how we intend to run our business now, and that the social safety and social will be assured. Government should look at it, make amendment, and give us go ahead. Unlike now that what we see is regulations and guidelines that makes our business difficult to operate.
But going forward, this is going to mean that you will have to adjust your business model.
Certainly.
Because even if the government takes everything you say on board, from what we know about hotels, restaurants, bars, lounges, all those places where the very essence, the very business idea is people gathered.
Yes.
So that will have to change. Are your members and others in this line of business thinking in that line?
We have to. It is a compulsory situation. Look at events where you have 3,000, 5,000 gathering in event hall. We don't need anybody to tell us that spacing will have to be discussed and agreed upon. The era of people sitting back to back, leg to leg is gone until we are sure that COVID has left the shore of the world, not even Nigeria alone, because it is not enough for us to leave Nigeria. We must be sure that international customers coming to Nigeria will not equally bring the virus back into Nigeria. It's going to bring an unprecedented dimension into the running of hotel business.
Thank you very much, Mr. Sam Alabi. Mr. Alabi, of course, occupies two positions. He's chairman of the Board of Trustees of the Federation of Tourism Association of Nigeria, and he's also the head of hoteliers in the nation's commercial capital. Thank you so much for coming on. Now, let's go over to the website of the Nigeria Center for Disease Control, the NCDC, to see the COVID-19 figures in the country reported in the last 24 hours. The total confirmed cases stand at 4,971. That's at this time, with 164 deaths recorded and 1,070 patients discharged from the various isolation centers across the country. The number of those being treated at the isolation centers around the country is now 3,737. The figures by region shows that Lagos in the southwest still has the highest number of cases in the country, with just over 2,000, followed by Kano in the northwest with 707 cases. The FCT in the north-central region comes next with 370 cases, and Bauchi still leads in the northeast with 206 cases. Edo State tops the list in the south-south with 89 cases, and Enugu in the southeast has 12 confirmed cases to top that region. To look at some of the health imperatives and why some of the businesses that we are discussing tonight are operating at low capacities, and some of them are in fact closed and have remained closed as a result of government guidelines. I now have with me a consultant public health physician, Dr. Dupe Akinyika. Thank you for your time. Thank you for coming in.
Thank you for having me.
There are those who will say that, as indeed our guest in the chair in which you sit now said a few minutes ago, that if banks were allowed to reopen, and with everything we saw in the immediate aftermath of their reopening, why were hotels, restaurants, bars, and so on not given the same guidelines and asked to reopen? What were the health reasons, or what are the health reasons why this group of businesses had to stay closed?
Now, this group of businesses the hotels, restaurants, tourism industry.
Indeed.
You know, what happens when they operate is more of what we get to do, social interactions. So there are close relationships during their operations, majority of their operations, in the gyms, in the spas, in the restaurants itself, in the nightclubs. So if all those businesses were not closed, we wouldn't be talking about just almost 5,000 cases now. We would be talking about thousands, hundreds of thousands of cases, because the transmission would have been much faster. Because one person with that infection in that kind of place would have spread it to a lot of people. And then those ones go back and then spread it to more people. Because somebody would visit one nightclub tonight. The next one, he's in another one. He's asymptomatic. And then he keeps spreading, he just spreads it, or even has symptoms, but he still wants to go out and party anyway. So he goes out and spreads it further. So by now, we would have been in a situation whereby our health services would not be able to take care of the people that would have been affected by COVID-19. So it was a good thing that
they remained shut.
Yes, that they remained shut.
If they were to reopen, as indeed many of them want to, because they don't want to send away their staff and all of that, apart from the business interests. What do they have to do? It can obviously not be business as usual, given what you've just said. I mean, even for public health reasons. What do they have to do to put themselves in alignment with the new normal of the COVID-19 era?
Okay, well, let me start from what they should be doing now already. With this lockdown, the easing of the lockdown, whereby they can now access their businesses, they can get there, but they are not allowed to open. What they should be doing now is doing, the much needed spring cleaning in those areas, maintenance of their facilities, making sure that all the repairs that they needed to have done, or if they were fully open, would constitute a nuisance to the customers if they were being done then. So all of those things, they should make sure that they're doing them now, all right?
Would this include things like fumigation and all of that?
Fumigation, yes. Cleaning up, for example, in hotels, under the beds, because hardly do hotel cleaners get under the beds. So under the beds, behind the frames, those hard-to-reach areas, they should do proper deep cleaning now and fumigation as well in preparation for business, because they will open, they must open. They can't remain shut permanently. And then apart from that, they now have to start to, from now, they themselves need to come up with their own guidelines. We're seeing that happening in some countries already. Big hotels like the Marriott, the Hilton, they are coming up with, their own guidelines on how they intend to open up in all these other countries, all right? So how their staff will be trained, because in trying to open up, they have to make sure that they're attacking or preventing COVID-19 infections from different angles. So they're having administrative controls, they're having environmental controls, they're using personal protective equipment when it's required, and then they are also ensuring that they are doing all those basic things that we already know about COVID-19. So, for example, with the administrative controls, by now, they should be trying to train their staff on infection prevention. So they should be seeing, okay, so how are we going to open for business when business opens? We can't do business the way we're doing it before. So they should start to itemize. They can use NCDC guidelines that have been given to other businesses and then use that together with their own. But before they do that, they should carry out some sort of risk assessment. So they themselves come into their facility or their hotel and see, or their restaurants, whatever it may be, and then see, a proper assessment of the risk. How can people contract it here? Is it by touching the surfaces at the counter, at the reception? Is it as they come in? So they do that, thorough risk assessment, and then they come up with infection prevention and control policies for their own establishment as well, while waiting for government to come up with what they're going to give us for them.
For them generally
yes.
as
So they start to have their own ready. And so they're putting in those things in place. For example, they know that by now they would need at the door to have sanitizers so people can wash their hands. They need to make sure that people coming in must not come in because it's a public place. So they must come in with their masks because that is regulation now. Everybody must wear a face mask. And then, of course, when they're attending to customers, so how are they going to do it to maintain that physical distancing that is required so that not only are they protecting their own staff, they're also protecting their customers. And then all of these things, by the time they have them written out, and then the customers themselves can, see what they're doing, not just by them doing it, but they have everything written out, outlined. And so they can send this out via the internet or maybe put it on posters. So this gives the customer themselves confidence that, oh, these people have our back. We know they don't want to get infected, but they're also interested in us not getting infected. Right. And so they're making sure, that transparency would also help in the meantime while they are waiting for government guidelines.
I must ask, because some of the mails that we got on this subject have raised the point, how is it safer or how is it different when people are allowed to go in and get takeaways? In the case of restaurants, eateries, and so on, because that is something that a lot of people do, particularly in the urban areas. How is it? Is it safer necessarily, or how is it different from when you go in, order your meal, sit down, eat, and all of that?
Okay, it's safer, which is why with the easing, you can now have takeaways, because for you to contract COVID, if everybody's wearing their own face mask, we're all masked up and all, if somebody has COVID and we're maintaining physical distancing, we have our face masks, and you don't stay there for too long. For example, from research conducted, you need to have been with that person for 15 minutes or more, right? So, but if all you're doing is coming in and then you just get what you want and you go away, then it reduces the chances because you're staying there for a shorter period. And then another thing they need to get into whatever they're planning is contactless service. So I don't have to buy it from an actual salesperson.
Right.
Yes, so I can order it. They can have apps whereby they can order it, and then all I just come is pick it up, and then that distancing. Exactly. So it makes it, we reduce drastically the number of people that are exposed to getting infected, as opposed to if we were all to sit in, and then of course when we sit in, we're gisting, and then we're closer, and then we're there for like an hour or two. So if one person has it,
you have more time to spread
it. Yes. And then in between, we're most likely not even washing the hands. We washed when we came in, but after that, we may not wash again, and so the chances are higher.
Thank you so much, Dr. Dupe Akiyinka, a consultant public health physician at this time. Thank you for coming in.
Thank you very much.
From here, we're going to go to yet another doctor, this time a pulmonary medicine specialist, also a specialist in intensive care, is a principal partner at Long Consultants Company in Nashville, Tennessee, in the United States, Dr. Olushola Ogutolu. Good evening, Dr. Ogutolu, and thank you so much for your time. Thank you for joining us.
Good evening. Thank you for having me.
Dr. Ogutolu, if you can hear me, how is the United States dealing with the challenge of the hospitality industry in this COVID era?
As you all know, if you can hear me clearly, this has been a profound public health event. It's of epic proportions that has touched every corner of the globe. Pretty much every continent except Antarctica has been affected. It has instigated not just fear, but in the United States, there has, after an initial shell-shocked reaction, we have been able to respond both the government and the private entities have gathered or marshaled their resources to confront it. Specific to hospitals and the hospitality industry, there has been both predominantly a government response, both in getting education out, creating awareness. The Center for Disease Control, the National Institutes of Health, and other such government parastatals have really gone into overdrive. Other aspects of the government have encouraged tremendous ramping up of testing. Now, I cannot emphasize that enough. You cannot identify cases, isolate them, track them, treat them, if you cannot test them. So this is really, really critical. And beyond that, there has been a lot of financial incentives and programs put in place to support pretty much every industry, but particularly the hospital system, the healthcare system, and the hospitality industry.
Now, I guess the hospitality industry would also include some of what we were looking at there, bars, restaurants, and hotels, and so on. Now, my question basically was, how are they coping? Because with all the guidelines and with all the rules that are now in place in the COVID era, all the things that people normally go to all those places for are now not quite acceptable.
So the world is going to change as we know it. The previous guest alluded to some of the things that have changed and will have to continue to change. Pretty much like what happened after 9/11. You go to an airport now, you know the protocols and procedures we have to go through. Much the same thing is going to have to happen here. A lot of it is still being worked out. We're in the active process of actually understanding what this is about. So everything from social isolation or social distancing, contactless protocols, minimizing the number of people that can be within any enclosure, and remote working if it's possible. And in the hospitality industry, obviously, you can't have an industry when people can't be there. But a lot of those mitigating protocols have been put in place. Now, all that is post the lockdown period. So a lot of cities on a rolling basis are starting to slowly reopen. There's not a unified strategy just yet. Again, all this is being worked out, but at the bottom of it all is the need to test, to identify, and to separate people who are at risk and people who have been infected from the healthy workforce.
You're a pulmonary medicine specialist, and I wonder what would be your own particular concerns with, in terms of health risks with this industry that we're discussing today.
So, specific to pulmonary disease, my specialty, and as it pertains to the lungs or lung health, a lot of what COVID does impact most other systems of the body. In fact, it affects everything from your nose to your toenail and everything in between. However, your lungs are probably they have the most contact with the outside world. We breathe all the time. So we're all connected and exposed to each other. So there have to be mitigating strategies in place, principle of which is to prevent people who are infected from dispersing the germ, and also for people around who are not already infected from catching it. I'm talking about masks. It is fundamental. It is absolutely fundamental. Also, something as basic as hand washing is foundational. It is critical. Beyond that, there's not a whole lot individuals can do per se, but the entities that run those establishments, like I said, have to really invest and educate in disinfection, deep cleaning, like we said. They may have to reorganize the layout, the workflow of the establishment, and also, as much as possible, have contactless protocols. There have to be more frequent washing of surfaces, including beddings. And people who have existing lung disease ideally should avoid as much as possible external exposure. But to the extent that they have to engage, it is critical that they protect themselves, primarily hand washing, wearing masks, and keeping adequate distance between them and anyone else out there.
Dr. Ogutolu, thank you so much for your time. Dr. Ogutolu joined us from Nashville in Tennessee. It was our pleasure to have you on the program this evening. Thank you so much for your time.
Thank you.
We'll take a break, and when we come back, we'll take a look at what is happening outside our shows. Please stay on with us. United Arab Emirates Vice President and ruler of Dubai, Sheikh Mohammed bin Rashid, has announced that more than 200 doctors in his country have been granted a 10-year golden residency visa for their work to protect the emirate against COVID-19. This comes as Dubai authorities are looking into what life may look like in the emirate if COVID-19 is to remain a long-term threat. The head of Dubai's COVID-19 Command and Control Center, Dr. Amir Sharif, says Dubai is looking into how to live with the virus long-term by balancing public health, the economy, and community life. In Dubai joins me now with more. Good evening, Mayowa. If you can hear me, this visa, this golden visa, is there more you can tell us about it?
Well, it is called the golden visa, and really, I think it's an amazing gesture by the government to the health workers fighting the COVID-19. We've got about 212 doctors in total who are going to benefit from this. And to give you context on just how big of a deal this golden visa is, it's something that was launched in 2019, just last year. And usually it's for scientists, investors, big-time investors in the country. They also have it for entrepreneurs, innovators, and scientists. And executives who earn up to 30,000 dirhams can also apply for this visa. So it's not something just anybody can apply for. So it's really quite exciting that the government is giving this visa out to over 200 doctors as a way to appreciate them for all their efforts fighting COVID-19 in the country.
The beaches in Dubai have also reopened, haven't they?
Yes, they have reopened. Of course, health measures are still in place. So you're expected to still wear your masks and keep social distancing and pretty much make sure you're still adhering to all the safety measures. But hotel beaches have opened as of now in Dubai.
All right, then. Mayowa Adegoke, thank you so much for your reporting from Dubai in the United Arab Emirates. And do stay safe out there.
Thank you.
You can find more information on the coronavirus pandemic on the website of the World Health Organization, including the World Body's response to the disease that has been confirmed in over 4 million people in 216 countries and areas of the world. Also, Channels TV's website has more details on COVID-19, including stories of survivors of the disease. Do a log on to www.channelstv.com. That's our package tonight on the COVID-19 update. My name is Ladi Akiri Doluale. We're back tomorrow at noon with an update at 6 and then at 9. Good night.